As 2025 is ending, and I was thinking about what different and meaningful thing I did this year. And yes, I did something different this year, something different and something adventurous, maybe. I mean, I don't know, is it really an adventurous thing? Because for me, that was an adventure. Anyways, I have worked as a behavior therapist with special needs children. Now, hold on. I know these are some really fancy words. At least these are fancy for me. But let me tell you who are behavior therapists, who are special needs children, and how I was able to even work with them. So, this year, Alhamdulillah, I was able to complete my bachelor's degree in clinical psychology. And yes, as a part of my degree, I had to complete a 300 hours or simply a 3 months internship either with drug addicts or with special needs children. Now, I was lucky enough that I didn't had to work with drug addicts because I think I'm not brave enough to even talk to them. It requires some strength and motivation. But yeah, I had to do my internship in a school of children with special needs. Now, let's understand who are special needs children. Special needs children are children who needs extra help and care in different areas of their lives. They have difficulties in learning, which also includes reading and writing. They might have limited vocabulary and they communicate with gestures. They understand commands slowly. They might have difficulties in learning their daily activities like eating, dressing, brushing their teeth, washing hands, or taking bath. Now, I'm not saying that they are completely unable to do these activities, but I'm saying that they learn these activities or simply anything slowly. They take more time in learning than a child of the same age does. Now, that was the Google's understanding I told you, but for me, children who have like delayed developmental milestones, they need help and care, and hence they are special. Again, very fancy word, delayed developmental milestones. So let's break down this terminology for now. So developmental milestones refers to skills a child learns as he grows. Mainly includes holding his head up, sitting without support, crawling, walking independently, saying words like mama, baba. So, whenever there is some delay in that, like if a child starts sitting late or walks late, then we can say that his milestones are delayed and the child needs further help with his daily activities. And that's the case, we say that a child needs special help and hence the child is special. So, I guess you have understood who are special needs children. Now, let's see who are behavior therapists. Behavior therapists are a kind of mental health therapist or simply psychologists who help people to adapt to healthy and socially acceptable behavior, and they help them get rid of their negative behaviors. Now, it can be a simple behavior like I want to get rid of scrolling, or it can be a more difficult to escape behavior like, oh, I want to leave drugs. Whenever I'm stressed out, I don't want to take drugs anymore, but I can't help it. So basically, behavior therapists help people with that. Now, since I haven't worked with adults, so I don't know practically how behavior therapists do that. So right now, I will just stick to the children part. So let's talk about my experience, which was obviously the main topic of discussion for this video. So in my first internship, I have to take behavior therapy sessions of 4 children. These 4 children included one child with Down syndrome, one child with ADHD, 2 children with intellectual disability. Because this was my internship without any supervisor, there was no on-site supervisor on my internship side, probably due to mismanagement from my university. I don't know, like I wasn't able to think of a word. Due to that, I didn't know what to do and what not to do. So what I did was I just played with them. Yeah, seriously, I just used to go to school, bring all children one by one for sessions, and I used to bring some blocks, paint, super clays, marker, crayons, toys, and put everything besides me. And then I used to pick up some stuff to engage them in different activities. And at that time, I didn't know what to do in behavior therapy sessions because apparently all of my 4 clients didn't have any problematic behavior. They were special, but they were stable. That even if I think now, There was no serious behavioral issue with them, which I felt needed to work on. So I think that was a positive side of my first ever behavior therapy work without any supervision. As a behavior therapist, the main thing I've learned was assessment. So, if you are going to work as a behavior therapist, then you cannot just randomly go to the child and start taking his or her sessions. You need to know the diagnosis of the child, or in simple words, what's the name of issue with the child. And to establish that diagnosis, you first need to assess a child, which is known as assessment. So, let's learn first what is assessment and how we do that. So, assessment of a child is more related to your observations, the history of the child, and the concerns reported by parents. Consider a child is brought to you and you don't know what the diagnosis is. Like in my case, it was ADHD, Down syndrome, and IED, but in your case, you don't know. So, you have to do these observations first. See if a child is responding or talking. Is he giving you eye contact? Is the child hyperactive? Or simply, is he sitting on chair or not? I know these are very basic observations, but I think you got the idea. Try to understand the mental level of child. Like, is he understanding or following your commands? Like, open the door, close the door. Does he respond verbally or use gestures only? You can also ask the parents, is he a slow learner? How he communicate with them? Now, it also depends on the age of the child, obviously. But for detailed assessment, you can also use Portage Guide with parents. It's like a booklet of questions which can help you understand a child in a more detailed way. Let me give you a practical example with my one case I had there. So, I had a very cute little 8 years old girl who used to talk a lot and her sentences didn't make any sense. Like she kind of had rushing thoughts, so she just used to jump from one sentence to another without any obvious connection between them. And her speech don't make any sense because it used to be so much difficult to understand what one specific thing she wants to say. But she had proper sitting and I think I only remember her uncontrolled speech for now. But I couldn't figure out what's main issue with her because her IQ was okay and she was not having any autistic traits. She was not hyper. So when I asked her teacher what's issue with her and how can I assess her or simply what diagnosis can I give, because for me uncontrolled speech was not making any sense. But my teacher said that uncontrolled speech is a sign of uncontrolled thoughts and uncontrolled thoughts is a sign of ADHD. So just assess her for ADHD. So let's take one more easy example. So if you have to observe a child who is able to sit in front of you, but he is not making eye contact and is not responding you verbally, and he is making repetitive sounds, which we call verbal stimming in a more professional words, and he has some weird movements of hands. So in that case, you can suspect that a child might have autism. And for the assessment, you will apply a test which will tell you is a child having autism or not, and if yes, what is the level of autism. Is it mild? Is it moderate or severe? In my case, we use CARS and ABLES, but there are also other tools to assess the autism. So that was something I wish I knew before my internship so that as a behavior therapist, I could have known like what to do with a child when he's sitting in front of you because I was so blank during most of my internship. Anyways, here are some small advices I want to give if you are considering to start working as a behavior therapist with special children. Number 1, in your beginner behavior therapy sessions, try to assess the developmental age of the child because it's so important and it will give you some foundation about how you are gonna interact with the child. And to calculate the developmental age, I use Portage Guide as per the recommendation of my teacher, but there are also other tools out there, so feel free to check them out, whatever works for you. Second advice from me is that don't get too friendly with a child with whom you are gonna take sessions. Okay, so this is very random and not very professional advice, but I got too friendly with them and I was focused on entertaining them more than focusing on their behavioral issues and even their assessment. And obviously, I've got good memories with them, but the negative aspect of being too friendly was that whenever I had to use any assessment tool, let's say CPM or BGT, they won't respond to me properly because they wanted to play. So it used to be so much difficult to get them to do what they don't want to. So I would say be firm in your tone because that was the main thing I have struggled so much. And the third advice will be that identify your roles. So your role as a behavior therapist is to assess or diagnose a child. After that, you have to identify problematic behaviors of the same child. And after that, you have to make a behavior intervention plan to simply manage the problematic behaviors. Like if a child is sitting on a wall, then you need to work on that. If a child is not making any eye contact, you need to work on that. If he don't sit, you need to work on that. So after assessment, you have to work on managing the problematic behaviors. The last advice from me is that take the detailed history of the child from his parents. Yes, you can take info about the behavioral patterns of child from his teacher, but for detailed history, you need to have sessions with parents as well. Now you might be thinking, okay, but what questions will I ask from parents? So for that, Portage Guide is very helpful because it has a lot of questions in it, which you can definitely ask parents to know more about the child. It has questions like when your child started walking, when your child started babbling, does he greet guests or not? These are questions which only parents can answer. Now, I'm not a certified behavior therapist right now, but as a student of psychology, I shared whatever I have learned in my first internship as a student, not as a professional. This was whatever I have learned from my internship. Obviously, I shared the assessment part in this video, but that's not really everything. The next step is creating and implementing a behavior intervention plan, and I haven't discussed that in this one due to the length of the video, but if you want to know more about that, I can definitely make my next video on these topics, so let me know in the comments.